I did an interview yesterday with a father who just lost his son to suicide. So first, I'm going to play a clip from Congressman Ro Khanna from California, who went onto the House floor to talk about the father and his son who just committed suicide. Let's play the clip from Congressman Khanna, and I'll come to you right after that.
Mr. Chair, I rise today to tell the sad story of Danny Desnoyers, who took his own life because he did not have the money to buy the basic drugs that he needed for his mental health issues. Danny Desnoyers was a young man who struggled with depression and psychosis, mental health issues that show no physical symptoms but take a deep psychological toll on those that they afflict. Daniel did the right thing. He purchased health insurance through the New York health insurance marketplace from Fidelis, a subsidiary of massive international conglomerate Centena Corporation. In March, Daniel went to the pharmacy to refill his prescription for risperidone, an antipsychotic medication that he needed. He was informed by the pharmacy that he no longer had health insurance, and the 1-month refill would cost him $250. Now, to some people, $250 may not seem like a lot of money, but to Daniel, it was. And according to a 2018 study by the Federal Reserve, 40% of Americans would not be able to cover an unexpected $400 expense. Daniel, unfortunately, was one of them. So he did not buy the medicine, and he began to ration his antipsychotic medicine, taking it every other day until he could get his insurance back. He contacted his provider, Fidelis, at the beginning of April when he learned that they had canceled his plan because he missed a $20 payment. Fidelis didn't immediately reinstate the plan. Instead, the company informed him that his coverage would not resume until May 1st. This meant another month without a refill of his prescription, another month without the medicine Daniel needed to function. His ration of medicine had run out. On April 9th, filled with thoughts of suicide, a listed side effect for antipsychotic drug withdrawal, Daniel superglued his seatbelt shut, posted a farewell message on Facebook, and drove his truck into the river, ending his life. Danny Desnoyers died at the age of 29 because he was late paying $20 to a corporation that pulled in more than $60 billion in 2018. Something is deeply wrong in this country where we let a young man die because he cannot afford medicine that he needs, and when his insurance is taken away because of a $20 missed payment. Daniel died because we have a system that puts profits over patients, a healthcare system that does not guarantee basic care for all people is a healthcare system that is broken. Medicare for all could have prevented Daniel's death, and it could prevent the death of so many others. Lloyd Doggett's pharmaceutical bill that would hold these pharmaceutical companies accountable could have prevented Daniel's death. 28 million Americans are still uninsured, and millions more are saddled with high deductibles and high premium plans, which lead them to forego the care they need. Medicare for All is the plan that will guarantee every American the basic care that they have a right to. Danny Desnoyers wasn't a perfect man. He didn't lead a perfect life, but he tried. And our nation owes it to him and others like him to make sure that they have the medicine they need to live with dignity. I will continue this fight for Daniel, for his father, for his family, and for all Americans.
So that was Congressman Ro Khanna, definitely one of the leading progressives in the country, on the House floor talking about Danny, who was 29. I spoke with Danny's father yesterday, obviously grieving, he and his wife. Danny was the father of two children. He was only 29 years old. When Congressman Khanna talks about him not being perfect, I talked to his father about it in the interview. Daniel had depression. He also had a side of mild psychosis. At times, he was violent, including with some of the female partners he had. Obviously, nobody condones that. His father explained, which you'll see in the interview on Sunday, that when he was medicated and taking his medication routinely, there was no violence. He was not a violent person. He was a funny person, a sarcastic person, a joke, somebody who always wanted to play. I know his father is actually watching right now. Scott is in the live chat there if you want to send your condolences. We haven't edited the interview yet, so it's going to look a little choppy, but I figured I'd rather show you some of it and kind of tease the rest. On Sunday, it will be fully edited, but we don't see these stories in corporate media. And I also think it's important to point out, actually, I'm going to point this out after I show you just a little part of the interview. So again, it's not edited, but you'll get the point.
You read any medical journal, talk to any doctor, they will say the biggest side effect, or one of the biggest side effects of being pulled off an antidepressant like this is it will escalate the symptoms it was helping with. In other words, if you were prone to hurt yourself, you're going to be more prone when you lose this medication because of chemical imbalance. This is a known fact. The fact that his insurance was canceled, they sent out a letter, I believe, to his home address where he wasn't allowed to go because of the legal problems that he was having, and he wasn't living there. Even if it got forwarded properly through the mail, it still would have received at our house too late for him to know that he owed $20. So regardless, these symptoms, these things are put in place on purpose by the insurance companies. They know if they put these hurdles in, people are going to lose coverage, and they don't have to pay the benefits, and they make money. So they set this up to make money knowing that this would be the result. They know that if you're on these meds, you might have a percentage to do this type of thing. My son's not a percentage. Not just a percentage. He's my son. He's a father. He's a brother. He's an uncle. But these factors were all weighed out in front of our lawmakers, and they figured this is okay. This is acceptable that a percentage of people are going to go through what I'm going through so that the insurance company could save money. I was never politically active. 47 years old, I cast my first vote for Bernie Sanders. He got me politically activated. That year at Phone Bank for the first time, never believed in politics before. Bernie in 2016 made me aware, along with millions of other Americans, that there's better systems out there. I had no idea that other countries had single-payer systems. We were taught our whole lives that America has the greatest healthcare system in the world. And this is a lie. We might have the greatest doctors. We probably have the richest doctors for sure. And I don't blame the doctors. I don't blame the hospitals. And I don't blame the individual insurance company. I blame all of them. I blame the lawmakers for allowing the insurance companies to do this to us. We need change. We need Medicare for all, and we need it now. We don't need to keep going through this sort of hell. My Bible tweet had thousands of other stories, just as bad, some worse than mine. I can't even fathom how there could be a worse story than mine. Every morning I wake up with the weight knowing I will never see my son again. I will never see his smile. I'm not the only one that's having this sort of crap going on in his life. And I can't just sit here and do nothing. I promised Danny's siblings at his wake that I will be on the Senate floor myself. I will look at these senators that make these decisions, and they will have to look me in the eye and see what decisions are, the consequences of their decisions. They have to look at a father knowing that they took his boy away by their decisions. This has to change.
So that was Scott Desnoyers, father of Danny, and Danny was 29 years old. And in April, after getting cut off from his medication for depression and psychosis, got so depressed and suicidal that he drove his car. Well, first glued the seatbelt to himself and drove into a lake. Here's Danny with one of his children. The full interview with Scott will air Sunday during our show, our live stream. It'll be edited, so you won't see that black space and everything, but I wanted to show it to you, even unedited. And I think it's important to make a point that Hazel, that was Danny's child, Hazel. I want to make a point that mental health is just as deadly as a physical illness. And I have depression. I take antidepressants. I was hospitalized a few years ago. I don't know if I've ever told everybody that. It was the best thing that ever happened to me. One of the bracelets I wear says strength on it. I got that in the hospital. I was in the hospital for 2 weeks. I was depressed and had suicidal thoughts and all that. It's the first time I've ever had suicidal thoughts. It was very scary. And I was fortunate to have health insurance at the time. And I was also fortunate that if what happened to Danny, if his insurance got canceled abruptly over $20, and if that happened to me and the medication cost $250, I'm lucky that my parents have the money to help me out. Many people have family that cares but can't afford $250 for medication. I reached out to Fidelis Healthcare. I gave them very specific questions yesterday. I followed up today. Shockingly, they have not responded. The fact that Danny, and you're going to find out more about the story on Sunday, definitely watch. The fact that Danny, because the paperwork was getting sent to a house that he was not living in at the time, as far as I know, Fidelis didn't answer. As far as I know, did they try to call him several times to tell him he had a remaining balance of $20? If they couldn't reach him, did they try to contact his emergency contact over his bill? Did they try any other means than sending a bill for $20 before they canceled his insurance? I don't know, because they haven't responded to me. I'll keep following up with them, but I'm assuming they don't want this story to get any bigger than it should get. When an insurance company cancels a patient, I also ask them, is it an automated process, or do you actually have humans that work for you that are looking at each case? Because if it's humans that are looking at each case, you have to know that canceling somebody who's on this medication, that person without this medication will rapidly start having the symptoms that this medication helps. Depression, suicidal thoughts. So, make no mistake about it. Danny was not perfect. His father and I talk about it in the interview. But this insurance company killed a 29-year-old with 2 kids by cutting off his insurance without even attempting. And again, I don't know. Maybe Fidelis did try to contact him and they couldn't get through. But they've had 2 days to answer me if that's the case. They have not answered me. They didn't try As far as I know, they didn't try to contact him. They didn't try to contact his parents. They didn't give him more time or an extension. They didn't, if he was late for paying the $20, they didn't, instead of filling the whole prescription, filled half the prescription. Or filled, 7 to 10 pills. So if Danny would have went and realized, oh, why isn't this the full amount? He would have known they canceled your insurance. But the worst part, Danny found out that his insurance was canceled, I think at the end of March. So he called Fidelis in the beginning of April. He paid the $20 right there on the phone. But he was told, yeah, you'll be covered again as of May 1st. Well, would you tell an old lady on oxygen, if the same thing happened, would you tell an old lady who needs oxygen, you cancel their insurance? And, oh, you paid the balance, you'll get the oxygen and the coverage in a couple weeks? You want to know why you wouldn't tell an old person that? Because older people are on Medicare. And they're covered, period. There's no difference between needing oxygen, needing insulin, needing anything for physical ailments than needing medication. Whether it's depression, whether it's psychosis, whether it's bipolar, whether it's schizophrenia, whether it's borderline personality disorder, whatever it is. And you know who I blame more than anyone else? And I'm not as angry and upset as Scott. I blame Nancy Pelosi. Let's forget the Republicans for a minute. I blame them too. But Nancy Pelosi is the top Democrat in the country. She's third in line to the presidency. She represents the most progressive state in the country, California. If she wanted to do it when she was Speaker of the House under President Obama, she could have helped push Medicare for All in when Obama was president. But she chose to push a Republican health care plan. Obamacare was originally a Republican health care plan hatched out of the Heritage Foundation. And why did she do that? Have anything to do with the pharmaceutical industry's lovely, lovely relationship with the Democratic Party and the Republican Party? Do you think California, which was on the verge of becoming the first state in the country to pass a state-based single-payer system, you think it would have passed if it had the backing of Nancy Pelosi? I think so. A 29-year-old is gone because healthcare in this country is connected to profit and money. You know, we have a lot of viewers that watch from around the world, and they just don't understand it. And I, in 2017, went to Germany, and I had dinner with a couple who watched me at the Young Turks. And we talked about it, and it was just like a way of life. Like, they didn't understand, our government pays for it. Because in some countries, governments actually, it's radical, represent the people. And actually care if the people live or die. So next time, CNN or the New York Times, they talk about Medicare for All as like the extreme left. The extreme left. You want to know why they talk about it that way? Oh, because CNN, they get really good health care from that company. New York Times, they have a great health care plan. When I was at MSNBC, health care plan was pretty good. They don't have to worry about health care. But you know what? Right now, you know how much I'm paying right now for health care every month? And full disclosure, Mama Chariton is helping me because I can't afford it on my own. I pay $630 a month for health care. That's before I have to pay copays or deductibles or all that stuff. Healthcare in America is health scam. Hope you enjoyed that last video. Hop on over to statusquo.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statusquo.com/join. And remember, join our email list so we can grow the revolution with you.